Hello, my name is Ryan Hogan. I am the SCA Administrator for Luzerne and Wyoming County's Drug and Alcohol Program. Today, we're going to be discussing navigating the drug and alcohol system, level of care placement, and identifying a proper need for treatment and how to access that treatment. First, in order to determine the appropriate level of care for an individual, the individual conducting the assessment must apply a level of care ASAM criteria. ASAM stands for American Society of Addiction Medicine. The ASAM summary must reflect the level of care the client needs, whether or not the funding or bed availability is there for a specific level of care. The ASAM should not be solely based on a level of care requested by the individual or a referral source. It is optimal for an assessor to determine a level of care based on client need, but also what the client may or may not realize is best for them. We must focus on individuals' needs first. The individual must have a scheduled admission date for the recommended level of care within 14 days of assessment. Now, 14 days is the longest stay someone may go through before being linked to treatment, but it is optimal to have somebody placed in treatment immediately upon completion of a level of care assessment. Let's discuss the ASAM. The ASAM is the American Society of Addiction Medicine. It has 6 dimensions. Number 1, acute intoxication or withdrawal potential. The goal here is to identify the detox needs, if any, of an individual and how severe those withdrawal needs are. Number 2, biomedical conditions or complications. Medical issues may interfere with the appropriate level of care placement and may need to be addressed in a medical facility or hospital before someone can be placed in a drug and alcohol facility. Number 3, emotional, behavioral, or cognitive conditions or complications. There may be some psychiatric or cognitive issues that interfere with the placement in drug and alcohol treatment. Those need to be addressed by the assessor before someone can be placed in treatment. Readiness to change. Here we identify the motivation of the client and their willingness and readiness to change and comply with drug and alcohol treatment services. Number 5, relapse, continued use, or continued problem potential. Again, our goal here is to identify the risk of relapse before, during, and after treatment completion. And finally, number 6, recovery environment. What will the individual being placed into treatment have when they complete treatment and are reintegrated back into their normal recovery environment along with their family and social contacts? So kind of like a step up, you'll see that there is an initial screening, which leads to an evaluation and assessment, which could potentially lead to a level of care placement in outpatient services, detox, or maybe inpatient services. What are some of the potential barriers of accessing proper treatment? One is a general lack of knowledge about the placement process, which our goal of today's session hopes to alleviate. Most people think they can just go directly to an inpatient rehab for admission and services, but are oftentimes met with an inability to do so. It is best to have a contracted drug and alcohol case management service complete a proper screening, assessment, and level of care ASAM before trying to enter an inpatient residential treatment facility. Bed availability could be an issue. You want to make sure that the treatment facility you want to go to for treatment services actually has the appropriate number of beds available for the individual. Timeliness of screenings and assessment. Can't stress enough that timeframes are important, and timeliness of screenings and assessments are crucial to placing somebody in the appropriate setting. If a provider cannot do that timeliness of screening and assessment in the timeframes noted, it's best to seek that service elsewhere. Regularity of treatment services. Individuals should get consistent and regular treatment services, more than one time a month treatment. Knowing the difference between fellowship meetings, advocacy groups, and treatment service providers. All drug and alcohol treatment is voluntary. You cannot force a loved one into treatment, and there is no such thing as a 302 or involuntary commitment into drug and alcohol treatment. It's always important to understand the funding, authorization, and utilization reviews, which is why it's important to utilize a contracted treatment provider. Feeding a system. Be careful that you are given options for different treatments at different providers. Some providers have a history of feeding their own system when that system may not be what's best for the individual. Remember, client need first. And sometimes a barrier to treatment is simply put, paperwork and the computer and technology that's in front of the assessor. Once again, here is a list of available treatment services in both Luzerne and Wyoming counties and some of our neighboring counties as well, including Lackawanna County. If you feel the need to speak to somebody now, I encourage you to contact 211 for assistance. Thank you for your time.